Hey, this is Tasha, the Crafty Kraut. I just wanted to do a quick update video on my Smile Care Clip. I am on tray number 2. I've had it in for a week, and just wanted to kind of go over the how it's been. So I've had it in for about a week. The first tray I put in, I wore for 3 weeks. It was kind of tight, but I didn't really feel any movement. I don't know, maybe a little sore a few days, but no, it wasn't, any soreness really. So I wore that for 3 weeks. At the end of the 3 weeks, it was really, really loose. So obviously it did something. So this tray that I have in, I'm on week 1. This is today's the week that I've had it in. So a week ago today I put it in. And it was tight. It was really tight. So the first 3 days I took Motrin a few times a day for the discomfort. It wasn't really like hurt, but I mean, your teeth are moving. It's a little uncomfortable. And I tried to make sure that I took the trays out, I ate, and then I put them right back in. The longest I had them out was in the morning for coffee, and I probably had them out for about half an hour, 45 minutes. That was just for coffee, and I just wanted to do it as quick as possible for those 2 days because I felt like if I left them out longer, it would hurt more to put them back in, or for my teeth to get used to it. But they're not sore at all anymore today. Actually, it only lasted 2 days. After that, they weren't really sore. Still kind of felt like when I took it out and I touched my teeth, they were kind of sore, but nothing really. So anyways, a few things. I have an emery board and I have some dental wax. This tray and the first tray as well, it kind of rubbed my cheeks and the inside where where your tooth is and then the tray is. It goes like right up to the top of your tooth, and for some reason kind of rubbed me a little raw the first couple of days. So I don't know why my husband would have dental wax, but my husband had dental wax, never had braces, but he had dental wax. So thankfully he had dental wax. So I just put a little dental wax inside the back of my trays, just on the top, just for it to heal a little bit. And then I took it out, and you kind of have to redo it every time you take in and out the tray. But after a couple days, I took it out, and it hasn't bothered me since. So it was just kind of getting used to the next tray. I take the tray out, I brush it really good with I have a separate toothbrush just for the tray. I take it out, rinse it with cold water, and then I usually brush it right away so I don't have to mess with it when after I'm finished eating. You got to brush and floss. That way the tray's already clean. I just rinse it back off and put it back in my mouth. Other than that, it's been going pretty good. I can already see some movement in that tooth, the second tray. I think by the 5th tray, I mean, they're going to be pretty. I have the 10 tray program, or the 10 aligner program, and I think after the 5th one, I think it's really going to be a big difference, kind of halfway mark. But anyways, it's tempting to have these aligners here and having to wait 3 weeks, but I do it by the book because I don't want to mess up my teeth or them to fall out or anything. So just whatever you do, make sure you leave them in for 3 weeks, and you don't cheat and put them in every 2 weeks, because your teeth have to get used to that position that they're in, and really the trauma of them moving. So you want to make sure that your teeth have a chance to kind of rest and get used to that position before you put in another tray to keep moving them. So you have to be patient. I think my husband would probably be on tray 5 by now, but I'll do it by the book, so I don't have any issues. But anyways, if you have a rough edge, you can use a little emery board. I didn't want to do that because it's in the back, and I didn't want it to mess up with the fit of my tray, so I just did a little wax. It wasn't sharp, it was just kind of pinching me. And it's fine now. It doesn't bother me at all. So just make sure you brush and floss really good. I have noticed that if I rinse with a mouthwash, especially one with alcohol, before I put my trays in, it seems like maybe it irritates me when I have the tray in. Maybe it was just a coincidence because the tray was new. But anyway, so I would go with a non-alcohol mouthwash to rinse your mouth, and you don't do that obviously with the tray in. Make sure you don't drink any hot or cold, and just stick to water when you have it in. And actually, I've read some reviews were like, how long does it take to get used to it? The first tray took me about 3 or 4 days to get used to. Really, by the last week, I didn't even know if I had it in sometimes. This one right here, this one I have in now, it's been a week and it really doesn't bother me at all. I have a slight little lisp, but you can't really tell. I think I can tell more than anybody else. And I'm just wearing the top tray. I don't wear the bottom one. I do put the bottom one sometimes at night, just because I don't want to grind and put any unwanted pressure on my bottom teeth, or for them to move any more than they have. So anyway, so you do get used to it, and you really don't feel them in your mouth anymore. It's just a little, you know, take them out to eat, and you know, I thought maybe lose weight with it, but not me. I just try to eat as much as I can while I have them out, and make the most of the moment, and then put them in, and just, you know, do that, I guess 5-6 times a day, because I eat 3 meals and then 2 or 3 snacks a day. But anyways, thanks for watching. Hopefully that's helpful, and I will do another follow-up video after I have tray 3 in. Thanks.